representative and as a parent, to be perfectly honest with you. The Centers for Disease Control estimate that approximately 17% of children across the United States are overweight. That number is 12.5 million children here in America. More importantly, that's 3 times the rate it was a previous generation. Many of these children are faced with serious physical, emotional, and social problems, all resulting from the health conditions associated with childhood obesity, and unfortunately, many of these conditions follow them into adulthood. Connecticut, the numbers are no different. Our Connecticut Public Health Department estimates that 25% of high school students are overweight. Both esteemed associations as well as many parents will tell you that this is the most inactive generation ever in America. The problems these students and children and potential adults are facing are grave. Physical problems include type 2 diabetes, orthopedic problems, sleep apnea, high blood pressure. Emotional problems are depression, negative body image, and social problems include stigma, bullying, and negative stereotyping. It's a serious crisis in terms of both physical problems and costs. Estimates in Connecticut alone, we spend over $800 million dealing with health conditions related to childhood obesity. I respectfully ask you to consider my proposal to put together a task force to study these important issues. In a perfect world, the task force would have members of the General Assembly, as well as community experts and physicians from across the state, and that they would consider both identifying our community resources as well as opportunities to get our children more active. Personally, as a parent, I can attest that it's more and more difficult to come home, whether you're a single-parent household or a dual-parent household from work, and the opportunities to get your children outside are more difficult when you're coming home at 5:30 or 6 o'clock. So if this task force can examine the possibilities and the opportunities to getting our children more active, and we, in our small capacity here, can take a task force and solve problems as bullying, physical problems, and depression by putting together a task force and identifying some of the solutions, I challenge you to do so. I'm happy to answer any questions, and if anybody wants more details, I'm also happy to provide lots of statistics.
Thank you, Representative. Last night I did a little bit of research online. Of course, our Department of Public Health did come out with a report that you probably have. Thank you for bringing that to our attention. That came out in October. And the alarming statistics there. I also found that there was, I think there was a task force, and they came out with some recommendations in a report in 2006. I don't know if you had seen that.
Thank you for the question. I have seen that. And unfortunately, when I read the report, and I actually asked my intern to try and contact some of the members that sat on the task force, and one of the general concerns was it was put on a shelf, and there it lies. Nobody did anything with a lot of the recommendations. I know personally I've tried to institute some of those recommendations at a local level by putting together some activities in the district to try and get the recommendations out to my local community. I think by reading it, there were no General Assembly members on the task force. It's my suggestion that some of us sit on that task force if you proceed, so that there's some accountability and that there's some investment from the General Assembly to actually move those forward. The task force also looked at a wide range of things, and I would suggest that this one, perhaps, if it goes forward, concentrate on physical activity. I think that's the easiest obstacle to tackle when everybody from Michelle Obama to the NFL's Play 60 program is looking for opportunities to get our kids outside.
Thank you, ma'am. Thank you for your diligence.